Hello, so today we're going to talk a little bit about myopia. What is myopia? Myopia is nearsighted. It's when you cannot see things in the distance, far away. It's very, very common. It's becoming more and more and more prevalent, and even at earlier ages. And so we want to talk a little bit about that. There's a lot of research out on myopia progression and how it's becoming such a prevalent issue amongst our populations, especially our children. So a lot of the research is now showing that the constant focusing up close is not good for the eyes, and that extra demand on that near attention is making the prescription get higher and higher and higher at a younger rate. So what we do want to educate is that you need to limit that digital device, those tablets, those phones. I get it, I'm a mom. You want to be able to give the kid something to keep them occupied for a few minutes, but just make sure that's limited. All day, every day, focusing up close is just not what eyes are designed to do, and that is making those eyes progress to have a higher prescription. The research is also now showing that we certainly need to advocate for more outdoor time. So they are recommending 60 to 90 minutes of being outdoor every day. And what that does is it stimulates the peripheral vision so it doesn't progress towards that nearsighted, high nearsighted prescription as much. The reason this is a concern, there's many. If your prescription gets too high, it gets harder to correct to perfect 20/20 vision with either glasses or contacts. If it's too high, the prescription gets thick or difficult to wear in both glasses and contacts. You also are at higher risk for some other diseases down the road. So just something we want to try and get a manage on right now, get a handle on with our kids. And we are starting to offer some of those treatment modalities to try and slow down that progression of myopia, which Dr. Horowitz can talk to you a little bit about right now.
So there are basically four ways of correcting myopia. The first and most common is eyeglasses. That's typically what most people expect when you have myopia. You expect that the eye doctor is going to tell you to start wearing glasses. There are some other options that we can now use to help slow the progression. We could use contact lenses, hard contact lenses that you sleep in overnight. You could use soft contact lenses that you'd wear during the day. Those are bifocal formatted contact lenses. And there are also eye drops that you could take once a day. And then those drops have been proven to help slow down the rate of progression. Each choice is different. Different people would want to do different things, and those are the things that we can talk to you about when you come in to ask us, and we can talk to you about it at that time.
But all of these treatment modalities have shown in the research and clinically to slow that progression at least a percentage. We know if you have the risk factors, if your parents are nearsighted or have myopia, you're going to get it. It's a matter of how high it's going to become. What we like to tell our patients is about 90% of it is controlled by genetics, and it is what it is. But there is a portion of that we can control, and we want to if we can, and that's where some of those treatments can come into play. Certainly ask us during your regular eye exam more, and we'd be happy to talk to you about some of those options.